Welcome to Watch DSN, Drugstore News' series of interviews with retail pharmacy leaders that are transforming their retail pharmacies into healthcare delivery destinations. I'm John Kenlon, Senior Vice President at Ensemble IQ and publisher of Drugstore News. Today, we're happy to have with us Lynne Fruth, President and Chairman of Fruth Pharmacy and member of the board of the NACDS. Lynne learned the business from her father, Jack, and has been just as committed to being your hometown family pharmacy as her dad. Established in 1952 with 30 stores, Fruth is active in the communities in which it does business in West Virginia, Kentucky, Ohio, giving back through scholarship and residency programs and the fight against drug abuse. Thanks for being here, Lynne. Are you ready to get started?
Absolutely. Thanks for having me.
Oh, you're welcome. So first question. During the often chaotic and stressful time of the pandemic, retail pharmacy across the country stayed open while a lot of other healthcare providers were closed and weren't seeing patients. Retail pharmacy stepped into the breach and was providing testing, vaccinations, medication therapy management, and more. It was no different in West Virginia, where you actually met with government officials to demonstrate what Fruth could do to play a role in diagnosing and protecting West Virginians against COVID. So would you talk a little bit about that experience, what you said to them, what kind of a response you got, what it took to get state government on board?
Great. We had tremendous success here in West Virginia, and being a small state, there's a lot of familiarity with the local brands. So when COVID began to hit in early 2020, I was having conversations with my colleagues in Seattle and New York, and I was hearing the horror stories, and I knew what was coming potentially. So we engaged really ahead of even having cases in West Virginia and started trying to contact the governor's office and the Department of Health and Human Services. And I really just kind of went out to the public and said, I need somebody who knows this secretary of HHS here, Health and Human Services, and was able to get a meeting with both that department and the governor's office through their chief of staff. And I really talked about how I was concerned that if West Virginia wasn't very proactive, I said, you know, we are a small state. We are not a very populated state. We have tremendous obstacles. And if we do not go out and demand our fair share of the vaccine, we will be getting the crumbs under the table, because I believe the big corporations and the government is going to likely be more inclined to send the vaccine to urban areas where they can vaccinate thousands in a single setting, as opposed to someplace where the delivery model is going to be a little harder. So I said, we need to ask for our per capita share of the vaccine. Based on population, if you send, 100 doses per 1,000 people or 10,000 people to New York, then you need to send the same thing to West Virginia. So we engaged early with those folks, and our Secretary of Department of Health and Human Resources here, Bill Crouch, decided as the only one, that West Virginia did not opt in to the federal program. And later when I talked to Bill, he said, we knew more about West Virginia and what it would take to get our people vaccinated. And we believed that we could do a better job with boots on the ground in West Virginia than what the federal or these large corporations might do. So they engaged a lot of local pharmacies. The big thing that West Virginia did was they called out the National Guard, and the Guard has actually been pretty much on active duty here for the last year. So they brought a lot of high-ranking Guards people out. General Hoyer had retired. They brought him out to kind of lead the logistical part. And he worked with all of these different agencies to really coordinate the delivery of both testing and vaccines. So early on, we were the first chain to do testing in our stores. We started with the drive-through testing with the anterior nasal swab. And that was a send-out test. And then later we partnered with the state, and we told them, if you will give us the testing kits, we will hold these events start to finish, marketing, set up, tear down, everything in between, and you will not have to support us with staff. And they didn't really believe we could do it, but we we started holding events, and we quickly proved that just with our Fruth staff and sometimes local volunteers, that we could perform 500, 600 tests at a setting in these communities. And so once we kind of had that sort of success, and the Guard came by and saw the efficiency and how operationally smooth it was, they basically just said, we're going to give you guys whatever you want, however many tests you want. So we've done, 30, 40,000 tests here in West Virginia. And then that opened the door for us to be involved early on in the vaccine process. It wouldn't be uncommon for me to get a call from General Hoyer to say, Lynn, can you possibly do this tomorrow? Or can you do this 2 days from now? And they would call me, or they would call one of the pharmacy executives, and the answer was always the same, sure. And then we would figure out how we were going to do it. So I really believe during COVID that a large part, we talked about this a week ago, a lot of what our executive leadership team focused on in the last 12 months was, how do we deliver the testing? How do we deliver the vaccinations? How do we operationalize these things both in the stores and in the communities to really attack this? So hats off to the guys who work with me, because they've all been out in the cold and the rain and caught their clothes on fire by the heater and everything else as these events have taken place, but we really serve the communities well. So with the vaccine, the state decided not to go the federal route with the vaccine, and they engaged their pharmacies. So West Virginia was the first state to get the first set of vaccines to the nursing home. I believe, and I don't want to misspeak about what the intention was in the other states, but our governor said, 80% of our deaths are happening over the age of 70 and 80. And the reality is, the people we need to get vaccinated are the nursing homes. And in some of these other plans, those would not have been done until February. And I think their thought process was, if we can stop the deaths and these long-term hospitalizations that are happening with the elderly, then we will take the pressure off of our healthcare system. And then when people do get sick with COVID, there are going to be beds for them to go to. And so to me, it made a lot of sense. So we got engaged in that, did a lot of the nursing homes in West Virginia. And then from there, it really would just be like on a day-to-day, week-to-week basis. We would get a call from the National Guard headquarters, and they would say, can you go out and do all the school teachers in this area? Or can you go out and do this, manufacturing plant? Or can you hold an event here or there? So I'm really proud of the choices that West Virginia made, because it certainly impacted the loss of life. And like I said, people who got COVID and died most often didn't just die. They went to the hospital. They were in the hospital for an extended period of time. They required a lot of resources that were then unavailable for others. So getting that population vaccinated was critical to taking the pressure off of the healthcare system.
So just a quick follow-up. You were proactive. You spoke to state government. You decided you were going to be aggressive about going out and testing and vaccinating. You put the supply chain in place. One thing you mentioned was marketing. How did you get folks in this state who are pretty spread out? It's a rural state, and stores are spread out. How did you get people motivated to go get tested and go get vaccinated?
So in West Virginia, and we still are in a Facebook kind of mindset here, although I don't do Facebook. I always say that as a qualifier. We have a huge Facebook following. So we actually have a more active Facebook site than Walgreens or CVS in terms of the amount of back and forth with customers. And so we really utilize social media. We utilized the local churches. We utilized the communities to really engage people.
That's great.
We had partnerships with a lot of churches whereby we had a set, you can use our parking lot every Friday from now until you don't need it anymore. They would help us with volunteers. We found the faith community to be a very good link into the outer reaches of the community, into people who didn't have access to register for things online. That was a big problem with testing initially. If you couldn't receive your results by email, most of the testing available you couldn't do because no one had the time to call you with the results. So we identified that early on with the state and said, when you eliminate the ability for people to get their results down to just, I have to have an email and I have to have internet connection, you've eliminated the two most vulnerable groups, the poor and the old. And so we asked the state for the ability to have a portal into the results that we could actually offer testing to people who didn't have an email. We'd laugh at these events because if somebody pulled up in a Buick, we would say, Drew, that car's going to need help. They're probably not. When you say, do you have an email? And they're like, oh, no. Well, how about internet? And they say, I don't know about any of that stuff. You're like, okay, I tell you what, we're going to register you. So our guys at the office came up with a workaround whereby they created an email account for them that was just really a fake email account with a standard password. And then they took their names. And then every week after these testings, that pharmacist would actually personally call however many people were on that list. Margie, this is Andy calling from Fruth Pharmacy. You are positive. You need to call your doctor. And there was a gentleman in particular who was in his late 70s, had no access. Andy said, I will do the test. I will call you. He called the gentleman and said, I'm really sorry, but you are positive. You need to, and he said, can you fax that to my doctor? Andy said, absolutely. I'll print the report off. I'll send it to your doctor. And the gentleman later called him back and said, and I quote, thank you so much. He's going to put me on those drugs that the president got.
Right.
And
That's great.
Yeah. And when Andy hung up, he looked at me. He's a pharmacist, our vice president. He said, we might have saved a life on Friday by being willing to test that gentleman, do the follow-up, and make sure that he was able to get treatment. So to me, that's really what it's about to be a community pharmacy, is not to just say, well, you don't meet the requirements, or we're not going to make special accommodations for you. So we did a lot of that on the testing side and gained a lot of trust from people who knew that we would be there to test. And then it also gave us a platform to really talk to people who were a little bit vaccine hesitant.
All right. So next question. Retail pharmacy has a lot of momentum after a strong performance. I think everyone would agree after COVID, and so does Fruth, as we just talked about. So after demonstrating Fruth's ability to get the job done, do you think that you've changed some minds in the State House and about retail pharmacy's future and what it can do in terms of delivering healthcare, where we could go next?
Absolutely. We, as a chain and pharmacy in West Virginia in general, got so much positive publicity from national and even international reporting. Somebody from Japan came in and did a story. Somebody from Las Vegas came and did a story early on about how are you all able to get this done? And it really was all about that cooperation and working together with the health departments and so on. West Virginia had a bill, it was called House Bill 2263, that was passed in this most recent session. And it was a sweeping support of pharmacy. It's probably the most significant state legislation since the Arkansas Rutledge case. It passed almost unanimously in both houses. One guy was absent apparently, but it addressed a base floor for reimbursement on commercial. So it's a NADAC plus a dispensing fee model that the PBMs cannot go below. It provides that PBMs cannot pay a pharmacy connected with them or owned by them a higher rate than they pay an independent or chain pharmacy. It allowed for no mandatory mail order, and also protections around 340B, because now there's sort of an attack on onerous reporting and changes in reimbursement around 340B. And so all of these things, including no ability to have preferential copays to steer a patient to a particular pharmacy, this passed, unanimously pretty much in both of the House and the Senate. And when we started working on that bill, which was introduced by the West Virginia Independent Pharmacists, which we're a member of that now, we quickly got behind it, and I called every senator on the committee, many of whom I knew personally. I hit up all of my business colleagues who knew any of the other people and said, hey, they need to support this, because look at what pharmacy's done for West Virginia. And a lot of pressure came to bear on the governor not to sign it. And I actually called the governor's chief of staff and said, I just want to let you know that, the governor's gone on TV every week talking about how great the pharmacies are in West Virginia. He darn well better sign that bill and not throw us under the bus, because we've talked about how much pharmacy's done. Now it's time to really show us in the passage of this state bill. And it has passed, and now we're moving on to rules. So I think it's been huge for pharmacy.
And that's now law. It's not a waiver. It's not an exemption. It's law.
It is law, and there are some questions as to whether it will apply to like Med D plans, but it's, I'm on a couple task force within ACDS and in some groups within CPA. And there's a lot of talk about this, because this is really a pharmacy supportive, fair reimbursement bill, which we desperately need if we're going to keep these pharmacies going. And one of the things that I shared when I was promoting this was, I said, we all know the movie It's a Wonderful Life. And the story is about, well, what would have happened if Henry Bailey had never been born?
Yep.
And I just turned that around and I said, where would West Virginia be if Jack Fruth had never started Fruth Pharmacy? If Fruth Pharmacy hadn't survived? How many people wouldn't have gotten tested? How many people wouldn't have gotten vaccines? How much worse could COVID have been? You need to think about that in supporting this bill, because if pharmacies cannot be reimbursed at a fair level, that's the future.
Yep.
And no one cares about their own like somebody from here.
Yeah. And if we don't stick up for ourselves, no one's going to do it for us. So that's great. All right. So another question here, switching gears a little bit. More and more retail pharmacy is providing healthcare through on-site clinics or telehealth, or they're doing with healthcare partners like local hospital systems. Fruth is getting involved too, joining forces with some regional hospital systems in the area. Talk a little bit about that approach that Fruth is taking, and why you're doing it, and how care could evolve in the future through those partnerships.
Sure. So we actually have been probably way ahead of the curve on this one. We early on, we were probably the first 340B contract pharmacy in the state back in 2010 or 2009. We had a small contract with a local FQHC, and we did it manually for a local organization. And then from there we grew, and now we have 340B contract pharmacies, contracts in all of our stores with multiple providers, because in West Virginia, quite honestly, almost every provider qualifies for 340B. So it is a huge source of revenue for these regional and critical access hospitals. So we have a lot of 340B. We've been a real leader in that and helping establish good policies around that and auditing and so forth. And then a few years after that, we opened up our first retail clinic inside of a Fruth Pharmacy with a hospital partner, and quickly decided that was a great way to provide care in certain communities. So we have 10 of our stores have retail, I call them retail clinics, in the pharmacies, where people can get walk-in care, some primary care. They're primarily mid-level providers, which is a more affordable option for people. And it allows the pharmacist, who has, for years, people come into the pharmacy and say, this is how I feel. Do I need to go to the doctor? Yes, you do. Or can I get something over the counter? And many times it's like, this is how I feel. And they're like, sir, I think you're having a heart attack. We're going to call an ambulance. Or I believe you're having a stroke. We're going to call an ambulance. So now we have this clinic that when a patient comes in and talks about what's going on, the pharmacist can say, you're probably going to need a prescription. I'm going to refer you over. I think you might want to go over to the clinic. We fast track those prescriptions, so it's a very seamless in and out for folks. They can get seen, get their prescription, and be on their way. And then we've also done a lot of partnering with hospitals and other things. We did a lot of joint vaccination events with health departments and hospitals, and proved that we can all collaborate and work together to really hit the parts of the community that are more difficult to reach, like the minority communities and the areas where there's not public transportation. So we've done a tremendous amount of partnerships, and every time we just grow that ability to have that relationship as a colleague where we're all working together for the betterment of the community. And I see that as just continuing to grow, because the pharmacist is a critical piece in the health and well-being of the patients. And eventually that'll probably all be connected. And we've been involved in meetings around ACOs and things of that nature, which have not yet come to pass, but we believe that eventually we will all be part of a great web to try to maintain a continuum of care that keeps people healthier and also reduces the healthcare spend for the state and the employers.
Well, let us know when you're ready to talk more about that, because we'd like to know. Final question. I mentioned it in the opening. Fruth has been involved in the fight against drug abuse. You've put in several, I think, medication disposal programs. Talk about how you're finding solutions to the problem and not just pointing fingers and looking to place blame. How are you finding the solutions? How are you implementing the solutions?
Well, the first thing I think about the drug situation is it's always sort of a gut check when something like this comes up. So it's been 8 or 9 years ago when we had the idea that maybe we would remove all the single ingredient Sudafed out of our stores, just pull it. And it was, what are we going to do? Are we going to do this? Is it the right thing to do? Are we going to publicize it? What are we going to do? And I would always think about it. And then I would always say, yes, we're going to do this. It's the right thing to do. And we kicked that off with then aspiring Senator Shelley Capito with a press conference, and it was huge news. And then Senator Manchin picked it up, and he really applied a lot of pressure to the major chains to remove it in West Virginia. And they would, somebody from Rite Aid would call me and say, what do you think about this? And I would say, well, your pharmacists don't like you handling it, and you're really getting bad press in the papers here because you're dispensing or selling a lot of it. So I think it would be a good move. And so we got most of the organizations to follow suit, and we did reduce the production of meth labs by about 60%. Now, there's still meth out there, but it was the cooking of meth that was really putting our children and a property at risk. So then the next thing that came down the road was, will we support harm reduction clinics? Will we support that? Well, yes, we'll support it, but are we going to go public? And you kind of go, well, I don't know if we should. And then I said, yes, we should. We should do it. And we should say, we believe that this is a means to help people get actively interacting with healthcare professionals who offer them the opportunity for recovery. So we were involved in the first harm reduction clinic in Huntington, West Virginia with Dr. Kilkenny. And that has been a big success in when they asked people in recovery, you know, as many as 50% said that they initially were approached about it through a harm reduction clinic because it brought them back into the mainstream. Then the next thing,
with 30 locations in this across those 3 states, you have a little bit of muscle to offer that.
Right. So then it was naloxone. Will you dispense naloxone? The governor, the former governor, contacted us and said, if we write a naloxone bill, will you agree to dispense it behind the counter? Another gut check. Is this something we should do? And a pharmacist looked at me and he said, Lynn, I went to pharmacy school to help people. It is not for me to decide who lives and who dies. I said, yes. So he asked, Governor Tomlin actually met with us, and we provided some language around that bill on the naloxone dispensing. And then we've subsequently offered that. We had all of our pharmacists trained alongside the first responders and addicts and their loved ones. And it really was a sentinel moment for many of those who had been so opposed to see the mother, the wife, the daughter of an addict going through this training to try to keep their loved person alive. And it really changed a lot of people's perspective. So I believe we've even had pharmacists be put in a position, not at Fruth, but in another public place where they've been the person to administer naloxone. So, like I said, every time you're faced with a decision like that in business, you worry about what are people going to think. But at Fruth, we always come back to, you just do the right thing. And then we said, okay, so now we've got people, we're trying to get them into treatment, but they go into treatment and they come out, and what do? They've got no job, they've got no friends, they've got legal problems, they've exhausted any financial opportunities. So we started a couple of scholarships for people in recovery. And the first scholarship, when I went to give it, the young man was a handsome young man, and his very pregnant, cute little wife was a childhood friend of one of my own children. And that's when I realized, you know, this drug abuse thing is not just inner city, Milwaukee, Detroit, Los Angeles. It's happening in our communities in West Virginia. And I was so inspired. That young man is now a school teacher at a high school in Kanawha County, has written a book, is an amazing success story. The next year, the winner was a young man who said, a year ago, I sat here when Nick won the award, and I told myself, next year, I'm winning the Fruth Scholarship. He's gone on to, he's in pilot school now. So, I mean, we've had amazing, just kind of, wow, these people are great people. So I met with Dr. Kilkenny from Huntington and Dr. Brummage from Charleston Health Departments, and I said, I think that we should start a big fund for scholarships for people in recovery. My 25-year-old son, Michael, was really pressuring me to say, you know, Mom, you're in a position where you could really make a difference if you choose to. And so I took that challenge, and he and I met with those folks, and I said, we'd like to start this fund. And they all said, yeah, we'd like to do it, but, you know, Lynn, we can't raise any money. I said, I tell you what, guys, I'll raise the money if you will support it. So Fruth kicked in $20,000. I contact my colleagues across the drug channel. The folks at Walgreens quickly donated 20,000, Cardinal, and then some other manufacturers. And so when in 2 weeks' time, we set up a press conference, 2 weeks from the day that we met at Panera to talk about the idea. We set up a press conference that was attended by both Senator Manchin and Senator Capito. And I was able to announce, to the shock of my doctor colleagues, that we had $100,000. And from there, it's grown with some other foundation gifts. And so at this point now, we have given over 75 scholarships to people who have completed recovery, who are either going back to work, need a certification. We said, we don't care if you want to become a tattoo artist, a hairdresser, a pet groomer, a phlebotomist. College isn't for everybody, a truck driver. We want you to have gainful employment that you can support your family. And we've had all sorts of people. We've had from social workers, we actually had a physician, we've had nurses, we've had phlebotomists, we've had truck drivers, welders, and folks that have applied for and received these scholarships. And now I'm starting to see, I saw one of those young ladies come through the testing of, a vaccine event. She said, I don't know if you remember me. And I said, I do. And she said, I just graduated from college. I was one of your Bridge of Hope scholarship winners. So it's a different time in our world, and we can't just continue to think about scholarships in the same way. Fruth provides 50 scholarships a year, but most of those were traditional. So now we are focusing some money into the recovery scholarships to help people get back into the community, get back into their family, and become a contributing person. And it's really been very fulfilling for us to do that.
I was going to say, it must be very, very gratifying when you have experiences like that and you see that it's borne fruit. That's wonderful. We hear a lot about community. We hear a lot about purpose. We hear a lot about, doing well by doing good. It's refreshing to hear from an operator like yourself, how you're really making a difference. Thank you so much for spending your time with us today. Lynne Fruth, President and Chairman of Fruth Pharmacy and member of the NACDS board. Thank you for being here. Really appreciate it. Thank you.
Been my pleasure. Thank you.